and welcome to another echo session of the Southern Regional Collaboratory Center of Africa, CDC. So we have about 10 people on the call, half of which are Africa CDC staff. So we have about 5 people on the call. So I'm just proposing we give it 5 more minutes, and by 2:10 we start. Hopefully we'll have a bigger representation. And if you've joined us from any country, kindly put your name hyphen your country. So I've seen Howard Nyinka has said Howard Zinka, Zimbabwe. So Amiro Tivane, you can also indicate which country you are from your handle. I'm going to put that on the chat. But let me just share the screen. Okay, good afternoon once more. It's 4:10, and at least we have about 13 participants, with 5 of them being Africa CDC. So it's up to 16 now, so more people are joining. So we can actually kick off today. Welcome once again to our bi-weekly Southern Africa Echo session, where we discuss issues of information sharing, emergency preparedness and response amongst countries in the Southern African region. And a Happy New Year to everyone. So just to kick off, the agenda has been displayed there. Before we do the introductions, I'll just take you through the etiquette. As you know, put up your name with the country you're from. So say it's John, Zambia, John, Mozambique, for ease of identification. Mute yourself when you're not talking, and if you have any questions, you can always use the chat functions during any presentation. So today we just going to go quickly through the introductions. To save time, I think I can just take a look at those online. So from Africa CDC is myself, and we have Chika, and we have Dr. Bakare, we have Dr. Maruta, we have the regional coordinator, Dr. Lul, and we have Mr. Yaya online. We have Almiro from Tiven, Mozambique. Almiro, if this is your first time, you can use the chat function to drop your email address and your designation. In Mozambique, we have Anne Mwale from Malawi. We have Dr. Owen Musupole, IPC Malawi. We have Francis, one of our rapid responders in Zambia. We have Howard Nyinka from Zimbabwe, one of our rapid responders. We have Moeketsi from South Africa. Thank you for joining us today. And we have Osvaldo in Lamia from Mozambique. Kindly also indicate your email and your designation in Mozambique. We have Sandra Michiri, Health Promotion from Zimbabwe. And we have Mr. Patrick Sakubita, one of our rapid responders in Zambia. So we have representation from Zambia, Zimbabwe, Malawi, Mozambique, and South Africa. And Loveliness Monday has also joined the call. So, okay, so I think that's about it for those who are on the call right now. So we'll just move quickly to the, okay, sorry, let me just give the floor to the regional coordinator for very quick, brief opening remarks, as we have a lot to discuss today, so that we can go quickly into the agenda of today. Over to you, Dr. Lul, for a very quick. Sorry?
You can proceed, I do the closing.
Okay, great. Okay, so that's actually better. You can round off when we're done. So we're starting, the second item is the second wave in Southern African region and Africa CDC's plan of response. So we are going to take you through a presentation with data of I want to make it bigger so that we can see it full screen. Okay, my screen has frozen. Let me just give it a minute to unfreeze. So as you join us, kindly indicate your country by your name, the display name, your name hyphen your country. Let me try to share my screen again. Let's say apologies. Sometimes technology fails you, which is just what is happening now.
Can you send it by email to me? Someone else? Is Yaya online?
Really? Come on.
Can you send it to someone else, maybe?
Okay, let me try and forward it because I really don't know what's happening. Let me just close it off.
Isn't it? Can you send it to me?
Yeah, I want to forward it. Thing is, the system is now frozen.
Can you log off and log on again?
My system is frozen, so I can't even do anything on my system. That's terrible. It just froze up.
Okay, can you come to my office and then turn yours off?
Okay, I think we're good to go now. It's beginning to respond. Okay, great. I think I have it back now. Sincere apologies.
Okay, so while we are waiting for Ezinne, okay, she has connected back.
Okay, great. So sorry for that. Technology just failed me and my laptop froze. So that was the problem. So Chika, you want to take up the EPI side?
Okay. So good afternoon, colleagues, and Happy New Year to you all. I'll be taking you through the epidemiological situation as of 5th of January 2021. So here is the global update, COVID-19 update as of 5:33 p.m. Central European time. We can see that over 83.9 million confirmed cases has been reported, and over 1.8 million deaths, also resulting to case fatality rate of 2.2%. And most of the cases are being reported from the Americas region. So please, the next slide. So this is the African update situation in Africa, and so far we can see the charts showing us the number of confirmed cases in Africa, and the red line shows the 7 days moving average. Over 2.8 million cases has been reported, and over 67,000 deaths, resulting to case fatality rate of 2.4%. Over 2.3 million has recovered. That is, it's 3% persons has recovered from COVID-19. Please, the next slide. So this table shows the cases, deaths, and the recoveries in Africa. The new cases last 24 hours is over 19,000, over 600 deaths, and over 13,000 recoveries. So far, South Africa, the northern part is reporting the highest number of case fatality rate, followed by the southern region. Please, the next slide. So because of time, this chart describes the number of COVID-19 reported over the past 4 weeks, and we can see that the y-axis is the number of new COVID-19 cases, while the x-axis is the week. So for this last week, you can see that there are higher number of cases being reported from week 28th December to 3rd of January. And yeah, so next slide. Okay, thank you. So we can also see the same thing, the chart on this slide, the same color. The gray color is represents the southern region. You can see that the average percentage change in new cases over the last 4 weeks is 40% for the southern region. Please, the next slide. Please, the next slide. Okay, so this an overview of all the number of all the countries in the region, in the southern region. So we can see South Africa, you can see the second wave clearly indicated on the chart. Same thing for Zimbabwe, for Zambia, also for Botswana. You can see an upward trend in these countries. Please, the next slide.
Yeah, you're on the next slide.
Okay, so for Angola also, it's also there are a number of cases reported, but it's not as clear as other region countries. I mean to say, so Swatini, you can see that they are reporting more cases. It's the second wave is higher than the first wave, and the same thing for Lesotho. You can see that the second wave is also clearly indicated here. And for Malawi also, we can see that they are reporting high number of cases in the recent time. Please, the next slide.
You're on the next slide.
So the last two countries, that's Mozambique and Namibia, can see Mozambique has been reporting consistently, and the same thing with Namibia is showing a high an upward trend, so it clearly indicates that they're on the second wave of the pandemic. Please, the next slide. So this trend, this shows, the map shows the trend of change of weekly new COVID-19 cases in the past 4 weeks. 8 countries there are no data or incomplete reporting, or probably there are no data from 8 countries, but 14 countries with average change of less than 10%, and 6 countries with greater than 10% average decrease, and countries with greater than 10% average increase, that 27 in number. Please, the next slide. So this is regarding the testing. Is the total COVID-19 test conducted in Africa, and so far over 26.6 million tests has been conducted, and 9.4 tests per reported case, and 10.7% positivity rate. So I think this is the last slide from my own end. Over to you, Ezine, and thanks for your attention. I'm available for any question.
Yeah, so thank you very much, Chika. So is there any clarification, any question on this part before we go into the second part, which is the Africa CDC response to the very obvious second wave? Is there any question? You can raise your hand. No question. So before we continue, I just want to take us back to this slide for this second part. You can see that in our region, the 10 countries in our region fall under this 27 that has reported more than 10% average increase, which means that's very visible from the epi curves we saw earlier. There is a very significant increase in the number of cases. And this is not just South Africa anymore. It is all the countries in our region. The 10 countries in our region are reporting more than 10% increase in cases in the last 4 weeks. So it's quite, we thought it was quite important for us to sort of re-strategize together with you, the member states, on how best we can buckle up. And as you can see from the epi curves as well, the second wave is so much like the curves, the peaks are higher than what we saw earlier when we thought we had peaked. And so that means, and this is just the beginning, which means that we definitely have a lot of more work to do to overcome this second wave. So we just want to give you an overview of the ways Africa CDC can support your countries. And broadly, we have about 7 areas that we have been supporting right from the beginning of the outbreak. So as you're aware, we've been sending COVID-19 response supplies to countries. We've actually done 4 full consignments since the beginning of the outbreak to at least all the 10 countries in our region. And these supplies have included IPC materials like the PPEs, the sanitizers, and of course we've been sending tests, kits, swabs, and some countries got ventilators, some countries got medications. And secondly, human resources, another area that we've been supporting countries with rapid responders. We've supported 4 countries with rapid responders, and we've supported 5 countries with community healthcare workers and lab scientists as well. And the third area is capacity building. We've engaged some of you, we've done trainings, we've done workshops, both at a continental level and with some countries in country, and even step down trainings in some countries. And as you're aware, Africa CDC website, where we put up policy documents and guidance that can help countries in their policy making and decisions. And so that's our way of offering technical assistance and guidance to countries. And also, we have just recently started participating. Well, in some countries, we have been participating in their EOC, the coordinating meetings for COVID-19, and in some countries we just started. And that's another way. During those discussions with partners and the member states, we also offer technical guidance. And also the cross-border surveillance meetings that we have attended, we also offer technical assistance and guidance during those platforms. So we also are involved in outbreak investigations, serosurveillance, mortality surveillance, and Africa CDC has been working on a vaccine strategy for a while now. And with time, I believe we'll start doing in-country sensitization. But we have had 2 continental-wide vaccine conferences to discuss just the way Africa CDC can support in this area, and having just that Africa approach to the vaccine strategy. And finally, genomics sequencing of COVID-19 variants. And as you're aware, we have been doing this for a while, and also with these new variants, we can also support countries in the sequencing. But like I said, these are broad, generalized areas of support. And now we want to, these are areas that we plan to support. We have been supporting countries, and there are some countries we've already done some of these things with. What we're listing here are proposed areas of country supports that we hope to achieve in Q1 of this year, and also looking at the second wave and the urgency that the support that countries will need. We're trying to see how we can better engage as well as support the countries. So we'll go country by country. With Angola, I don't think we've really had any participation from Angola on this call in a while. We will be sending supplies to all the countries in this first quarter. So And in addition to that, the support for community healthcare workers. The last echo session we had was on this issue of community healthcare workers, where we had experience sharing from Zimbabwe. And this Community Healthcare Workers Initiative is under the PACT initiative of the Africa CDC, where we want to support all countries in Africa with community healthcare workers to help out with contact tracing. And as cases are increasing, it's very important that these people are engaged to help and increase the manpower for the response. But the challenge we've had with Angola is that we really don't have a concrete contact person with Angola. And unfortunately, they are not on this call, and we have been trying to reach out to them to support. For Botswana, we'll still send supplies once more. And for the community healthcare workers, we just recently, I think last week, was it this week, engaged the permanent secretary on this. We've been trying unsuccessfully other times, but I think we've finally gotten someone who can we can work with to move this agenda forward to support them with community healthcare workers. But just to note that Botswana has confirmed the new variant, which seems to be more seems to be easily transmissible or more transmissible than the other one, and public health safety measures have been tightened. Eswatini is the same. We are going to send supplies, and we also want to support with community healthcare workers, but we don't have anybody yet that we can really work with on this. So if you're from Eswatini and there is somebody, you know, the email of someone who we can write to engage to support your country with community healthcare workers, kindly just reach out via the chat function. For Lesotho, it's the same. To send supplies as well as support to community healthcare workers, and we successfully engaged the Director General of the Health Service. And the remarks there, these are the areas that Lesotho has highlighted where they need more capacity, more supports to increase the testing sites, increase contact tracing, and support for intensive care. So for Malawi, same, we are going to send supplies. We've already supported Malawi with community healthcare workers, and we have an IPC in-country training that is pending. All has been finalized, but it was just put on hold because we had an embargo on travel within Africa CDC, so we weren't able to go to fund that training. And we're also currently processing vehicle for the rapid responders we've already supported Malawi with. Malawi is currently collaborating with South Africa to confirm the new variant in their country. Next is Mozambique. It's the same thing, the supplies and the community healthcare workers, and we've successfully engaged the Director of the National Public Health, Director of the National Ministry of Health, DNSP. NSP is the National Health Authority. Then Namibia, we will also send supplies. We are currently processing the vehicle for the rapid responders there. We have initiated a process to support them with community healthcare workers, and IPC training is the same as the situation in Malawi. We will continue once the travel ban is lifted. South Africa will send supplies, and I'm glad that someone from South Africa is around who can give us a clearer picture of the situation in South Africa. We have a challenge. The last consignment of supplies we sent to South Africa, we've been told that it's yet to be picked up from the airport, and this has been over 2-3 months now, and we've been writing, we don't know, we've really not gotten any feedback. So I'll really be grateful if we can get some feedback from this platform. For Zambia, we will support with supplies, and the IPC training is the same situation, as well as risk communication training that was also planned, but also had to be put on hold because of the travel ban. And Zambia has confirmed the new variant as well. Zimbabwe is the same situation. We send supplies, and the risk communication training is also pending. And Zimbabwe has gone on a 30 days lockdown. And these trainings will continue once we lift our ban. So these are the areas that we as Africa CDC are sure that we will be able to support in Q1. However, some of the countries have reached out to us, and these are the areas that we are currently engaging with our headquarters to see if it's possible to support. So Namibia has requested for those, and we're currently waiting for an official request from Namibia to table before our headquarters to see if we can support these areas. South Africa has requested for more IPC trainings and to be supported with more rapid responders. Zambia also wants more rapid responders. Zimbabwe just reached out for support in the activation of their EOC. Lesotho is requesting for more cartridges for the gene experts, and as well as Malawi. So we have seen all these, what we plan to give the countries and also what the countries are requesting. But there have been challenges, some of which I have highlighted while I was talking, that there are some member states that we've not been able to actually engage. As you're aware, we really don't have country offices, we have regional offices, and usually we engage via the focal points or via contact people, some people who have attended our meetings, to help us find out what's happening in the country or help us reach out to the right people. So sometimes there's language barrier, there's just sometimes no response at all. And the second point also alludes to the same issue, that some of the people we know in country, some of us who attend this ECOP meeting where we share all this information, are not, they don't have direct contact to the authorities that make the decisions and are able to take action. So we have these meetings, you have this information, you see all the good things that could come to your country, but you don't have the authority to make the decision, and you also don't have links to the people in authority. So we're trying to see how we can rectify this situation. Also, we are having an issue of limited data from some countries. There are some countries that have every week sent us data, which is very impressive. And each time we reach out to them, they send us data. But there are also some countries where we don't have any information. And as you can see, this data helps us to plan. It helps us to understand the situation, and it helps us to project how we can better respond. And data like the tests done, healthcare workers infection, this helps us decide which country needs this particular support or the other support. So these are some of the proposed solutions. Like I mentioned, we are trying now we had initially had countries nominate focal persons, but some of these people are no longer in those positions to help us or support us. So we have recently sent out a note verbal again through the embassies to the countries to reappoint focal points, and we're waiting for this because I believe it's really going to help us, especially if these focal persons are people in authority that can really act as a liaison for us. This will really help our situation to be able to reach the countries as quickly as possible. We're also asking that member states are written to some people directly, but I'm also making that plea here that member states to share the links. Meetings are virtual now. So since people are no longer meeting face-to-face, there are now virtual COVID-19 coordination meetings, especially these ones that are being coordinated at the EOC level, where other partners come into the member states and other partners come to strategize and discuss on how to better respond. So if you can share these links to these coordination meetings, Africa CDC can be present, and that way we get first-hand information, and it's easier for us to also give technical advice, like I mentioned earlier, as well as strategize better on how to support the country. And the third point on data sharing. So for the lab people, it's been a bit standardized. We had shared tools with them to give us weekly data on the number of samples number of tests done, and some countries have been very, very consistent and some haven't. So it would be nice to have all countries report. And for surveillance data, you can email Chika, or also you can also share the information like some countries have been doing via the WhatsApp group. And for IPC, it's important that we have data for us to be able to inform policy and action. The data on healthcare workers infection already come a long way to help with that. And you can also share with Chika, or all of you know the IPC focal points know Ario. You can also share the data with Ario. So that's all from me. Thank you very much. And the floor is open for questions, contributions, and feedbacks. While I check the chat box, let me see what's there. Okay, South Africa has.
Yes, thank you very much, Esne.
Okay.
Yes, sorry to interrupt. I wanted to before you go on to questions, to just also maybe outline to the member states that are here. You have listed some of the areas that you are in current discussion with headquarters for possible support that are linked to some specific member states. Some may be here and may want maybe you to outline what is the standard process for them to make these official requests. Like you indicated that some of them have indicated the willingness to have this support, but they've not yet requested for that support. So what would be the standard process that they will have to follow when to make official requests for such support? Over.
Okay, thank you very much. That's very important. We've actually done a presentation on this before, but we'll also repeat it. So for community healthcare workers, there is already an established mechanism. We already have written verbals to your embassies. We have written to your ministries of health. So for community healthcare workers, what we need is the contact of somebody who is in charge of that program. We write to the person and share a form. So once you fill that form and send back to us, the process has been initiated. That one is really simple and straightforward. So once you fill that form, share back to the RCC, we're able to initiate the process and now start planning on how to support you with community healthcare workers. But that's for the community healthcare workers. Then for other support, the human resource and all that, you need to write to Africa CDC, an official letter signed, stamped to Africa CDC requesting for this support. Then it can be taken up. There are two routes. That is the straightforward routes, and there is also the route of writing through your embassies to Africa CDC. But of course, we know that that takes a lot of time. And because we're in a response emergency mode, rewriting an official letter to Africa CDC requesting for this support, you can share it with you can send it to the RCC email. We forward it to headquarters. Once you do this for the human resource, what else is there? Thing for the human resource, for trainings. Once you do that, but this has to come, it has to be signed, not just anybody. It has to be signed by probably countries differ, the PS or the director of the National Public Health Institute, or someone in that capacity that coordinates the program in the country. So those are the two ways. And for the things like the gene expert, sometimes actually just writing an email to the RCC with the quantity is enough for us to, since we've already started giving support to you, we've been sending gene expert cartridges, just writing to the RCC is enough to initiate the process of the help. So these are the different ways based on what you're requesting for, that the Africa CDC and the region can support you. So thank you very much, Dr. Maruta, for for that, helping us with that. So actually, one of the questions in the chat is this: how can we access support on human resources? So Dr. Moeketsi, we had a call with you last year, and we also suggested that you write to Africa CDC requesting for support. States what you want, what human resource you want, the quantity, and probably some justification, and of why you need the support to Africa CDC headquarters, and it will be followed up. Okay, so we've gotten a contact from Eswatini. Thank you very much. We've been looking for this Eswatini contact. So that's the email of the PS. So we'll write to him to follow up on the community healthcare workers. Okay, so okay, awesome. So now we have a confirmed South Africa focal point for the Ministry of Health. So that's Dr. Moeketsi, who is the Director of Africa Relations. So Dr. Moeketsi, thank you so much. We've been trying to get some substantial designation from South Africa. So this is very helpful. Really had quite some information shared today. So this has been a successful meeting. Okay, sorry. So the floor is open for contributions, and we can wrap up this section. We would like to hear from the countries. We've heard from South Africa and Eswatini, but other countries would like to hear from you before we go to the next part and wrap up for today. I really need somebody other than me and Dr. Maruta to say something. Annie, you can speak. Thank you.
All right, thank you. I have a few questions regarding what has just been presented. The first one is on sharing data. I think you mentioned that the lab developed a tool that is used for sharing data with Africa CDC. I'm just curious if a similar tool is there for surveillance, or is it just a surveillance focal persons should just share the situation reports that we produce for in-country use? And what is the frequency of sharing this data? And that did not come out clear. And then I also wanted to get an understanding of what sort of contact tracing support is Africa CDC able to provide to member states. And with new cases, the increase in the number of cases that we're seeing, we're identifying gaps that we need support in. So I wanted to check if we can still submit more requests apart from what has been listed as this is what you're already engaging headquarters to support the member states with. And finally, on the Gene Expert, how soon should we expect the Gene Expert cartridges? Because we've been experiencing, I think, a global shortage for quite a long time now. And I was thinking that the move now is towards using, we're trying to move to be using the antigen rapid test, but I haven't seen anything on the RDTs. So is Africa CDC also going to support procurement of rapid diagnostic tests for member countries to use, well, so that we can expand the testing? Thank you.
Thank you very much, Annie. Your surveillance question, Chika will answer that. Dr. Maruta will take the question on the antigen tests and the gene experts. And on the issue of, we have 3 people who have their hands up. Stephanie, Dr. Nyambe had their hands up, so I'll get to you. And then on the issue of the contact tracing, we already supported Malawi with community healthcare workers, and contact tracing is part of the work they're doing. But if you need additional support, the person who coordinates that is, you reach out, okay, Annie, I'm going to have an off conversation with you on this to link you up with the person who is coordinating it, because there is already an established mechanism of requesting for more. We've supported Zimbabwe 2 or 3 times, 2 batches actually. So I'll reach out to you for this, for additional support for community
All
health.
right.
But the other two, Chika can take up the surveillance question, and Dr. Maruta, the antigen test and gene expert, and then we can go to Stephanie and Dr. Yambe. Is Chika online?
Yes, I'm online. Well, I'm trying to see where the question is. I can't find the, is it?
Okay.
Can you read it out?
The questions she asked is, we have shared, Stephanie can also answer this question if she has an answer. We have shared, for the lab, we have a template that we use to collect data, and they share with us every Sunday. Now she's asking if there is a template for the surveillance. We've said they should share surveillance data. Is there a template, or do they just share C-trips, and how frequent is it? Stephanie's hand is up. I think she wants to address this.
Yeah, so if you guys can hear me,
It's breaking.
okay. Yes, there is a template for surveillance, and that was with countries along with the template. Oh, sorry. Hold on. Let me know any clearer. Is it better or worse? Is it okay now?
Better, yes. It's
It's
better.
better now.
Okay.
It's better.
Okay. Sorry. So we do have a template. We can share it with you, Ezine, and you can share it with all of the folks on the call. The same with the lab, that we request at least once a week. And if you have routine or regular situation reports, or if you have a website or a dashboard that you routinely update, you can also share that information with us as well. But I'll share the template with Ezine, and she can pass that down to you. And again, feel free to reach back to Chika or myself if you have any additional questions. Over.
Okay, thanks, Steph. I guess that's why your hands were up. And Dr. Maruta, the issue of the antigen tests and the gene experts.
Yes, thank you, and Chair, and thank you, Malawi, for raising that question. So I think on the cartridges, as you may understand that there's, I think currently a lot of pressure on the global supply chains for cartridges. So I think it has been a challenge to access these countries for maybe distributing to member states. Therefore, at this juncture, I think it's difficult to give a specific timeline. This is why maybe the Africa CDC and also with other partners, including WHO, have been encouraging countries to also consider taking up use of antigen testing for COVID-19. I was in the call yesterday for your EOC for Malawi, and I was glad to note that you have taken up use of antigen testing for most of your sites. So probably this is the maybe most viable option now in terms of your screening, especially in your ports of entry, given the increased movement of people in this time of the year. I hope this helps. Over.
So the second question is Africa CDC going to also procure these antigen test kits for the countries?
Yes, there's some consignments that countries have already received and some that are on the way. So yes, Africa CDC will be supporting countries. There's also a guidance document on the use of antigen testing in the current pandemic that you can access from the Africa CDC website. It clearly, I think, gives some guidance in terms of where, how, and when you can deploy the antigen testing and what sort of algorithm you can use as part of the response. Over.
So Annie, what you can do is just to help us with quantification, you can also share, if your country has done any quantification for these antigen tests, you can share with us to help us when we are distributing to member states. And then Dr. Yambe, you had—
All right, thank you.
Dr. Yambe?
Yes, can I go ahead?
Yes, you can, please.
Thank you so much, and good afternoon all, and thank you for this opportunity to speak. I had a few comments. I think One is how can we support the region as a regional strategy in terms of support. I think in this view, we might need to look at the common things that each country needs. With this new strain that we are seeing, of course, we may need to deliberately support all the countries to be able to conduct the genomic sequencing and phylogenetic analysis so that we understand whether we are having more of cross-border transmission in the region or it's more of community than international travel. So maybe we might deliberately look at ensuring that each country has that capacity and supporting with the necessary logistics that go with phylogenetic analysis. Then the second component is within each country. Now we are talking about FIOCs and IMS. I think we need to make these very strong, looking at the state of the pandemic. We need to ensure that each country has a strong FIOC, each country has a strong IMS, and key decisions coming from those FIOCs and IMS should be supported so that people get used to this new system for incident management system. And by following this IMS, I think we'll automatically be supporting each of the key pillars in each country. For example, we know we have pillars that deal with case management. We have pillars that look at surveillance. We have pillars maybe that look at the lab. All the components in this response are very critical and very important. So sometimes if you see a country picking out just case management or just IPC, you get a bit worried and say, are they okay with surveillance? Are they okay with the geospatial mapping? Are they okay with the field teams? There are a lot of practical things, I think, on the ground that we are seeing, which are highlighted on a daily basis in the incident management meetings. For example, how do field teams expand their contact tracing? How do they move? Do they need fuel? Do they need many people? All these nitty-gritties emanating from IMS need to have a voice and support. So I think once we make the FIOCs strong and IMS and look at their needs, we should be able to have one joint response as a region, and also ensure that the FIOC in each country talk to the other FIOC in the neighboring countries, so that we look at one regional approach to the response and also strengthening the in-country response. So that's the comment I wanted to make. Over to you, Hazel.
Thank you so much, Dr. Yanvi. On this genomic sequencing capacity and support, Dr. Maruta, do you have anything to add? I think this came up this morning as well. Is there anything to say now, or we'll get back to countries on this? Dr. Maruta? I think he has dropped off.
CDC.
Okay, yeah, you can continue.
Yes, Africa CDC late last year launched the Genomics Initiative, which is being supported by a number of partners, and resources have been put together. So currently, there is, within the first quarter of this year, there are plans to capacitate countries with the capacity to conduct sequencing in country by providing equipment, as well as conducting the training. So at the moment, countries are being line listed by priority, which the HQ will determine. And there will be communication soon in terms of especially the training that will start first, followed by subsequent support of the equipment required for sequencing, as well as the supporting supplies to do that. So yes, there are plans to support countries with sequencing, and this is expected to start early this year. The countries have not yet been specified as they are currently being line listed by priority.
Okay, so thank you very much. That's why if you need
Let me just compliment a little bit.
So yeah.
In addition to what Dr. Kapo just put together, if there's a country that's in need support or help from the African CDC, we encourage them to write it officially. So there's a process in place, so they can submit a request that they need support from the African CDC to support with sequences. So I don't remember what was the country you spoke.
Okay, it was Zambia, but like he just said, it's better if you have this need, write and officially request so that once it's being rolled out, your country can be prioritized because you have indicated a need for these supports. So that's why we're encouraging, if you have that need, just write to us. We have plans to do this, or write to us so that your country can be prioritized, time for rollout. And for the issue of the IMS regional strategy, it's really the goal that we can have EOCs speak to each other. And that's why we have started reaching out to countries to share their links with us, the meetings, the EOC meetings, the IMS meetings, with us so that we can participate in these discussions and support the country through these existing structures of the IMS. And with time, we can work towards having a sort of link between all the EOCs in the region. That's the long-term plan. So I think we can wrap up today. It's really been very productive, this session. Oh my, we're actually 4 minutes past the time. Dr. Lul, sorry?
I have a quick one, just
Okay, great.
thank you. Appealing to the, especially to the rapid responders who are sending us our report, if you can also help by including other diseases in order to support the EBS with our event management system reporting. We know that we are dealing with a pandemic, but we must not forget about other life-threatening diseases which are, of course, circulating in the region, as this will help in tracking them so as to avoid another outbreak apart from COVID-19. So yesterday, when we attended the Malawi EOC meeting, we were able to pick up an outbreak of typhoid. And this is very much helpful. So we hope that the rapid responders, you can help us in reporting other diseases, as this will help us to track the events that are happening within the region. Over.
All right, thanks a lot. So essential services and other services must go on, even if COVID is on our necks. We had one more agenda item today, but we're over our time limits. Dr. Lul, I beg that we can move this agenda item to our next ECHO session. Is that okay? Is Dr. Lul online?
Isn't it? Sorry, I just want to quickly find out if there is any representative from Angola in this call, because we are in their need of their laboratory data. So I don't know if there is any representative from Angola, or if anyone can help to, but basically, is there anyone from Angola?
Anybody from Angola? I don't think so. Chika, I'll have a chat with you. I can share some contact. Okay. So Dr. Lu, we're asking if we can move the agenda item to next ECHO session.
Let me just wrap it up in 5 minutes if everything is finished.
Yes, this section is just to wrap up.
Okay. Well, thank you. Let me seize this opportunity to wish all of you a happy new year. And also I thank all of the member states that has participated. This meeting has been very, very fruitful. But as you have seen it from those presentations, our region is being disproportionately affected by COVID-19. And there's a big need for us to work together more than ever. And the good thing that the African CDC has been mandated, that has a regional mandate, that we can be able to work across the member states. But we need to have very, very effective coordination. We need to have very effective contribution and commitment from the member states so they can be able to help and access the available support that we have at African CDC. And I think this meeting is very, very strong, and we encourage all the member states to continuously participate in these meetings. The last slide that we presented is a need, the support need of areas. So I would encourage all the member states who participated who did not get a chance to affirm their need, please to do so within 2 days, so we can be able to follow it up with the HQ based on the country needs, a specific country need. I think that was the whole objective of this meeting, that we need to make sure that we are meeting the country need. We are not making the assumptions on what the country needs are. So when it's, the country affirm those needs, it will make it more helpful for the RCC to follow it up with the HQ, and also to get prioritization and also get the timely response. The last agenda item that was moved, so if you give me a 2 minute, I will just also wrap it up. And this is also in line with how to improve coordination and how to have a better understanding of why the Regional Collaborating Center, the Southern Africa RCC, has been established. So we are proposing 26, 27 this month. There will be a virtual meetings at very, very high levels. The government of Zambia, they graciously accepted to host the launch of Southern Africa RCC in Zambia. But most of all the participants will be participate virtually. So the reason we don't want to postpone it, because in 2 weeks we will have only 10 days or less to work it out. I just need to inform you that this is a meeting that will happen. It's being proposed for 26th and 27th. And the big objective of this meeting is to operationalize the Regional Collaborating Center. In addition, we'll give member states a better understanding on why the Regional Collaborating Center exists and how the collaborations and the support that is available, so in what area the country will know it, especially all the ministers of health in this 10 member state will be invited and will be participated in one way and another. And also during that launch, we will have an opportunity to inform the member state about some of the priorities of the RCC. In particular, is the integrated regional integrated surveillance and laboratory networks. That is a key priority that will address some of the key issues that we are dealing with it in context of the COVID-19 and beyond. It's particularly the cross-border coordination, how to improve it, how to improve the laboratory network and systems, how also to improve the rapid response to any outbreak that is coming up. So we hope by Monday next week, the concept note that will be approved by the HQ. And from Monday or Tuesday, we can be able to share it with the key partners in the country when it's become official. So this is in brief. If we will have more information that we would like to share with you in the next ECHO meeting, we will do so. But with this, I would like to have the last opportunity on behalf of the Southern Africa RCC to thank all the members who are participating in this call. It has been very, very fruitful, has been very, very strong. And I urge all of you to take opportunity to seize those services that are available from the African CDC. So I remind you to fill in the gaps, to affirm and confirm some of those proposed available support by today or tomorrow, so we can be able to move on. But most importantly is that our region has been terribly hit, and we would like to thank all of you for the effective leadership, for the commitment, and for the work that you do. Either you do it with the Minister of Health, you do it as a part of the African CDC, or you do it as any role that you play. We truly appreciate it, and we wish you all the best, that you you committed for the safety and well-being of the people in this region. So thank you, and I wish you all the best. I look forward to seeing all of you in our next ECO meetings. Thank you.
Okay, so just the last one before we go. Eswatini, Google, kindly share your quantification. You sent me a message on what you need, but we need the quantities of those supplies, as well as that official letter, probably from your PS, for the rapid responders. And thank you, Zambia. They have shared their EOC links with us as well. So we're also hoping, I know some of you need to get permission from your authorities before you share, but if you need us to write officially to them as well, my email is there. Just drop me a message send me an email. We can officially write to them for you to release the links to the EOC meetings. So thank you, everyone. Today we had 8 countries on the call. Just Angola and Botswana did not join. And we're also beginning to have more high-level people. We have high-level people from Namibia and South Africa actually join us today, as well as Malawi and Zambia. So we hope to have more of these people in the decision-making authority to join in these calls as well. So thank you, everyone, and have a very lovely afternoon. Very sorry for the 40 minutes extra, but I think it was worth it. So see you next 2 weeks Wednesday, and stay safe.
Yeah,
Thank you.
Stay safe.